Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. US President Donald Trump announced in January a pause on foreign aid for an initial 90 days as part of a sweeping review of government spending. Now, since then, the majority of programs under the U.S. Agency for International Development, USAID, have been terminated. From Bangladesh to Southern Africa, the consequences have already been felt. Now, how much damage has already been done, and is there a way back from this crisis? Well, joining me now to discuss this further is Dr. Tom Ellman, who's Director of the Medical Unit for MSF Southern Africa. Médecins Sans Frontières, MSF, also known as Doctors Without Borders, provides emergency medical humanitarian assistance worldwide. Tom, thank you so much for being on the show with me. Can we begin our conversation maybe clarifying a little bit more about the U.S. funding cuts? What do you understand to be the current status at the moment? Has the U.S. government fully terminated foreign aid funding, or or is it still under review and might be resumed after that initial 90 days?
Thanks, and thanks for having me on the show. Yes, so the first thing to say is we are still in shock. This unimaginable, destructive change to the global humanitarian landscape that is being wrought. Our latest understanding is that as of the 10th of March, what was initially a provisional freeze, a temporary pause, has been enacted permanently for 83% of USAID funded programs. It's an unimaginable number of programs, of people, of communities who were absolutely dependent on that funding. And as of the 10th of March, our understanding is that that has been made permanent. Now, of course, we hope, believe, and will still fight hard to see if this can be reversed, but that's where we are now. And that funding was responsible for, the US is responsible for over 40% of all global humanitarian funding, 42% of all global health financing from international donors, and specifically to some of the areas that my team and I work on, HIV, TB, and malaria, hugely important. Over 70% of global HIV assistance came from PEPFAR and the USAID funded programming.
Wow. Has MSF been impacted by these funding cuts?
So not directly. MSF is in an incredibly privileged position of being able to rely on private donors. So 98% of our funding comes from over 7 million individuals in 40 different countries who entrust us with their support. So we are able to be independent, and we don't accept any money from the US government or any European governments. But that doesn't mean that we're not impacted, because in many of the countries where we work, the communities who we support rely for much of their care on funding that is received from government and from the US. And now they're coming to us, desperate, wondering, where am I going to get my healthcare?
Tell me more, Tom, about the programs that have been hit the hardest. What have been some of the immediate impacts that you've observed, particularly around healthcare systems following the termination of the USAID funded programs?
So as I said, the US funding is incredibly important for humanitarian assistance in many of the most devastated communities, war-torn countries, people affected by epidemics and famines. So people who are dependent on nutrition for support, for example, in the Horn of Africa, have seen much of that funding cut. And Africa is where I'm based, but you'll speak later about Bangladesh and other countries in Asia, Latin America. In terms of healthcare specifically, as I said, the US was responsible for supporting over 70% of international HIV-related assistance. And it's been estimated by UNAIDS that over 6 million people could die in the next 5 years if this funding cut is not reversed or made good. The US funded, PEPFAR funded over 20 million people's antiretroviral treatment, 20 million people who depended on it for a pill every day for treating their HIV. And over the next few months, we will see many, many people dying. Every day people are dying because of a lack of access to those drugs. Every day children are becoming infected because their mothers are no longer able to access the treatment. So TB programs, malaria programs, HIV programs. And one of the most difficult things is that often the funding was for those areas that governments weren't focused on. So community support, for example, particularly communities who have been excluded and criminalized by the government. So migrant and immigrant communities, undocumented migrants, key populations, as we call sex workers, drug users, LGBT communities, often were reliant on community support that was funded through USAID. Their support has disappeared overnight. So a dramatic, very, very wide range of communities have been affected. And it's impossible to pick just one. It's an unimaginable catastrophe for these populations.
So the progress that has been made in dealing with HIV/AIDS and TB, is that all at risk of being undone? Are we likely to regress back to undo all the years of the work, of the progress that we've made because of these funding cuts? Is that the concern at the moment, Tom?
Absolutely. It is already being undone. We are seeing a rollback. We are seeing a reversal of the reduction in incidence, the reduction in new infections that we've been pushing so hard for globally with so many partners. And the tragedy of it is that we are able to end the AIDS epidemic. We are able to reverse TB infections globally, which are currently the biggest infectious disease killer. We have new tools. So just recently, at the end of last year, the HIV world was celebrating about long-acting injectable treatment and prevention, which has the potential to mean people could be essentially vaccinated. I shouldn't really use the word, but a once a year injection has 100% efficacy in preventing HIV in some of the most vulnerable populations, young women, adolescent women, sex workers. And the hope of rolling that out, which we are still pushing very hard for, is damaged by this USAID cut.
Okay, so what are the strategies right now? So is there anything being done to mitigate the impact of these funding cuts? What options are on the table at the moment, Tom?
So there's a huge amount being done. I mean, the first thing to say, the most important, is that they must be reversed. Of course, it's important that countries become less dependent on foreign aid. And that is a process that many of us have been working to over many, many years. It doesn't happen overnight. This sudden cut cannot be compensated in the short term, so it must be reversed. The second thing is that governments, affected governments, must step up and, as far as they're able, cover the gaps. And in countries like South Africa, which were less dependent on USAID, that's possible. But still, it's a dramatic challenge for those countries. Others that are 80%, 90% dependent, it's impossible. But still, there needs to be those efforts. We need to see other countries in Europe and Asia, Latin America, stepping up to cover the gap. And unfortunately, we're seeing the opposite. We're seeing many, many European countries following the US lead in reducing their international assistance for humanitarian and health aid. And finally, we need to see communities, and we are seeing communities stepping up, as we did during the COVID pandemic, which in some ways had a similar catastrophic impact on health services. And communities coming together has been perhaps the most important silver lining, that people are ultimately informing themselves, learning more, and fighting for their own health. And we stand with those communities. Right.
Tom, that's an excellent point that you brought up about how there's been a Western retreat from foreign aid. So it's not just the US and their very abrupt cut, but the UK has also cut funding. I think their aid budget is at the lowest it's been for decades. France and Germany recently had aid cuts as well. what do you make of this? Is this donor fatigue? Is this a misalignment in terms of national interests? How are you interpreting or digesting what's next for international aid with this trend of a Western retreat from providing aid that we've seen for the past decades?
Well, that's a question that goes well beyond my field of expertise. The geopolitics of all of this is something I wouldn't care to speak to. But what I do know is that the national interest and populist national interest that seems to be driving some of this reversals is deeply misguided. And there are myriad ways in which it is shown that national interest and global interest cannot be separate. We saw with COVID what happened when an infection that started in one part of the world wasn't controlled, and all of the impacts and all of the rationale actually behind investment in assistance is ultimately enlightened self-interest. So I can't speak to exactly why it's happening, but it is deeply wrong-headed and needs to be reversed.
And for someone working in the humanitarian field, what is it that you would like the audience at home to know about how we should respond to this trend? How should the international community watching at home really respond to this humanitarian funding crisis? And it will have a ripple effect, as you've clearly pointed out to us during the show.
Well, I think that this point about recognizing that our own safety, our own health, ultimately is interconnected with the safety and health of people across the world. And if we forget that, we are sowing seeds of destruction. So I really hope that everybody realizes just how important it is that countries, and particularly those countries with greater wealth, assist countries that do not have it, in order that one day all countries are able to manage their own health needs. But we're a very, very long way from there, and we need to reverse these cuts.
Are you hopeful, Tom, for the future of humanitarian support?
We have to be hopeful because, yeah, what else is there?
I understand. Tom, thank you so much for being on the show with me. Dr. Tom Ellman from MSF Southern Africa there. We're going to take a quick break, and then we're going to turn our attention to Bangladesh and find out the impact of these cuts on Cox's Bazar. Stay tuned to consider this. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about the impact from the US's decision to cut funding of foreign aid. As we heard earlier, the US is the single biggest aid donor, contributing up to 40% of all global humanitarian aid. Joining me now from Bangladesh is Antonino Caradonna, who is the head of mission for MSF Bangladesh. Nino, thank you so much for being on the show with me. I'm curious to know what have been some of the immediate effects on humanitarian operations in Cox's Bazar, in the biggest refugee camp in Bangladesh, particularly after this recent suspension of funding.
Hi, Melissa. The situation is still fluid. It's already more than 1 month that the cuts have been announced. However, yeah, as I mentioned, we have to see most of the effects coming. Let me give you a bit of background on that. We are talking about the biggest refugee camp in the world, slightly more than 1 million of Rohingya refugees there. There are already a lot of unmet needs in terms of health, education, protection, water and hygiene as well. So these cuts announced in 2025 will very probably get the situation, will make the situation even worse, for sure.
Right.
I can give some anecdotal example of it. We observed already that some of the primary health centers in the camps reduce massively the services available, maintaining the emergency ones. Specialized disability services for more than half of the camps have been suspended. Significant shortages in sexual reproductive health care, supplies, and commodities affected 20 facilities. So yeah, situation is not nice at the moment, for sure.
Right. We also have heard that it's not just to medical care, it's also been to food rationing as well, and all other humanitarian aid. Can I ask you, so beyond kind of the operational challenges, what are you most concerned about in terms of the long-term implications for this, for the communities at Cox's Bazar? And if funding remains suspended, what are you most concerned about if this continues?
Yeah, Rohingya refugees, families, children, women, should go back to Myanmar when their safety will be guaranteed and the dignity respected. Right now, conditions to assure that are simply not there. So indeed, until when Rohingya will not be able to come back to Myanmar, dignified living conditions in Cox's Bazar should be guaranteed. So in my opinion, if humanitarian organizations will not have the necessary financial capacity to run their activities, the risk is that number of emergencies and outbreaks will increase, and also the sentiment that is already there among the Rohingya population of lack of hope for a better future will be even more widespread. To give an example, in the last couple of years, from 2022 to 2024, the number of suicidal attempts among Rohingya patients increased to 50%, and 80% of these patients who try to commit suicide are women. So again, situation was quite dire before these funding cuts, and if this will be maintained, situation will get worse.
Right. Thank you for bringing that up, because we have been reading about the loss of hope among the refugee community in Cox's Bazar, particularly because this has become such a protracted humanitarian crisis. It's been many years now that we have, and there's no hope for no kind of light at the end of the tunnel of hope for the future. So with these funding cuts, Nino, can I ask you if there are contingency plans? I mean, clearly there has been an immediate impact felt, but going forward, is there contingency plans to ensure that at least there is the continuity of vital health services there?
As far as I know, organizations and agencies are meeting in order to organize themselves and select which are the more vital and most needed services to be maintained in place, for sure. The GRP, the Joint Response Plan, is actually the main source of funding for the Rohingya response, will be basically cut as well. There are different rumors about more than 50% of cut. So wow. I think that it will be very important to continue with a selection of vital and important emergency services, because this is the path that the organization are obliged to take with these cuts and in this context.
Right. Can I ask you, so I understand that MSF is not impacted directly by the funding cuts, but with all the other kind of the ecosystem, the local services being impacted by US funded programs, how has that operationally challenged MSF to keep doing what you're doing there in Cox's Bazar?
Yeah, let me quickly share some information about MSF, because we have 6 health facilities in Cox's Bazar among hospitals, clinics, and healthcare centers. In 2024, we took care of patients. We had 200,000 medical consultations, 60,000 mental health consultations, more than 4,000 deliveries of newborns. So this data is to give you an idea that we already are at our 100% capacity since already last year. Having other organizations and agencies downgrading and downscaling their activities and their services, this will probably mean higher demands of MSF services in general. So possibly we will have to make some difficult decisions in terms of which services to prioritize and also which patients as well, because we are already at our 100% capacity since last year.
Wow. Do you have a message, Nino, that you would like to convey to international audience, the international community, the donors, the policymakers, regarding the severity of this funding cut on Bangladesh, and also the importance of sustained funding for humanitarian initiatives there?
Yeah, I really think that the needs are here and now in terms of protecting and delivering good quality services to Rohingya refugees present in Bangladesh. But the root causes of this situation is not here. It is in Myanmar, in Rakhine State. Is there that Rohingya people have been killed, injured, raped, deprived of their lands, their future as well, and to live in peace. So my call for donors and for the international community is to deeply engage to solve this critical problem at its base, which is in Myanmar, on the other side of the border. To give, I think, quite interesting number, I said before that more than 1 million refugees is there. 200,000 among them are children who were born in the camp. They didn't see anything else than the life in the camps, and they never see other than the camps landscape. So this is something that should be addressed as soon as possible.
Nino, thank you so much for speaking with me today. I appreciate you sharing some of your the insights from your work there in Bangladesh. Thank you for your time. That was Antonino Caradonna from MSF Bangladesh there, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.